Yes.
Yes.
It appears most people are experts too. Today we are not a big house. So basically we are going to discuss COVID-19 in the family and cover just a few things that you should know. Most of us will probably have already experienced this, but just in case you haven't, we'll run through this. And the theme verse I have chosen for us is Ephesians 6:12. For our struggle is not against flesh and blood, but against the rulers, against the authorities, against the powers of this world's darkness, and against the spiritual forces of evil in the heavenly realm. Whatever we are dealing with, we must remember it may be beyond us. There is more and more evidence that is coming out now to suggest that COVID-19 is not a naturally occurring virus. And therefore, there could be people who are actually benefiting from its presence. And it is important for us to remember that we're in a spiritual battle between those who want to do good and those who want to do evil. Now, just a few terms that are important for you to understand. When we say COVID-19, we're basically describing an infectious disease caused by the severe acute respiratory syndrome coronavirus 2, which we abbreviate as SARS-CoV-2. So when you say COVID-19, it is the disease, the disease, but the organism that causes that disease is called SARS-CoV-2. The other thing is the issue we are discussing today is isolation, which basically means you're already sick with a disease that is contagious and you're being kept away from the people who are not sick. This is not sick, not sorry. You're being kept away from people who are not sick. Then there is the term quarantine. Quarantine basically means you may have been exposed to somebody who may have potentially infected you, but you may not have symptoms, you're not sure. Again, basically, you isolate yourself, you wait for the 10, 14 days. If you develop symptoms, then you know you already got the infection and you start on treatment. If you don't develop any symptoms, then you know you did not get the disease, or you got a very mild one and you may develop immunity, and therefore it is not a cause for concern. So those two, sometimes people get confused when you say isolation or quarantine. Isolation, you're unwell. Quarantine, we don't know. You're on observation as we wait to see whether you got the disease or you escaped it. Now, something that I'd like us to go through very quickly that is causing confusion. I don't want any of you to leave this discussion without being very clear. If COVID-19 came into the country in March and we did absolutely nothing, no social distance, no hand washing, no masks, what would have happened is that the infection would have rapidly increased in the population, and then it would reach a peak. And that peak reaches when you have about 70% of the people developing immunity, and very quickly and very rapidly, the infection quickly disappears and dies away. Like most flu pandemics, that is what would happen, whether you intervene or not. The danger with that state is that if this dotted line here is the capacity of our hospitals, then it means that all these people who are above that line may die not necessarily because we don't know what to do about the disease, but because there is no hospital capacity to take care of them. So when we talk about flattening the curve, all those measures that the government has advised us on, social distancing, physical distancing, washing hands, wearing masks, staying at home if you don't need to go to work. The whole idea was to flatten the curve. Now, when you do that, the rate of infection in the community does not stop. Please note the infection doesn't stop, it slows down. And when it reaches its peak, the peak is below your hospital capacity, but it takes longer for the disease to die down. Now, why does the curve flatten? It flattens because you develop immunity. So let's again not be confused by people who have different agendas. If immunity was not developing in the community, if it was possible for you to get COVID twice, or at least majority of the people could get COVID twice, then it would mean that this curve would never flatten until the whole country has died off. The fact that it flattens off generally means that there is immunity that is developing in the population. Why are we getting waves, second, third waves? You get a wave like the third one we got, containment measures were put in place, the curve plateaued, started flattening, and then schools were opened. Children got infected, came back home, and all the parents who had managed to stay at home then were exposed to the virus, and we got that third wave. There is a fourth wave that has been predicted by the government. They are suggesting it would be because of the Indian subtype that was noted in Kisumu. But my thought is at the point at which we locked down the country, when Nairobi was at its peak of the third wave and schools had just closed, especially boarding schools, then people were given the 2 days to travel out of the city and jobs were closed. Then a lot of infected people went mashinani, and therefore I would expect there would be some spikes in most of the major towns around us. The prediction is that the fourth wave would peak around July. So the waves are not necessarily because of the variants, is because of relaxing and putting back measures, relaxing and putting back measures, and they are generally expected. They are modifications of the wave because of relaxing measures. What are the objectives of these interventions? The first objective is to stop deaths from COVID-19. So we are doing all these things, social distancing, washing our hands and all that stuff, to stop any further deaths. The other thing is that we would want to eradicate this disease. We would want it to go out of our population so that we can quickly go back to normal. Now, there are a few people who are suggesting that the only way we can go back to normal is if we vaccinate. And at the end of this discussion, we'll probably be able to find an answer to this question. Right now, only 1 million people have been vaccinated, and now they're getting their second shot. Is 1 million out of 53 million Kenyans. We are talking about mixing and matching vaccines. We are talking about countries like India that are no longer sending out their vaccines. We are talking about Africa being the last to get vaccination. Is it true that the only way to solve this problem is through vaccination? Maybe we shall be enlightened by the discussion. Now here I've attached for you the link to the Ministry of Health home-based isolation and care publication. But for this discussion, I shall use the document that we use in the Nairobi hospital. So at this point, I will stop these slides so that we can go to the next item, which is this one here, is the Nairobi Hospital Guide. So this is the Nairobi Hospital Guide for patients. If you test positive, this is what we send you so that you know how to take care of yourself. Is a guide for mild COVID disease being managed at home. It has most of the things that we would need to know. And we'll start first with the symptoms. And if you look at them, fever, continuous cough, maybe running nose, headache, sore throat, loss of taste and smell, nausea, vomiting, diarrhea, shortness of breath, you see that they are very common symptoms that we get from flus and cold. So it is not possible to differentiate whether you have a mild flu or whether you have COVID at the onset of the disease. Because of the fact that COVID is when you develop symptoms can be deadly, it is important during this time that we have COVID in the country that if you develop any of these symptoms, you assume that you have COVID. Okay. Now, if you have been diagnosed The advice from the Ministry of Health is you stay at home for at least 14 days. You stay calm. Ensure that you have a family member to look after you. So you shouldn't be alone in the house where you're being observed. If you are alone, then try and keep connected to people through the phone or video calls. You advise not to go to work, don't use public transport, do not go to public places. And basically all these things are aimed at you not spreading the disease to others. So if you have flus and colds at this point in time, as you do your tests, if the test comes back positive, then it's important that you protect others by staying at home. Now, how should you isolate yourself? You separate yourself. If your home has an extra room, then you can stay in one of the bedrooms that is well ventilated. Then use that room alone. If there could be an extra bathroom, then that would be nice. Avoid sharing items. Keep distance if you have people with you. Wear your face mask. This is very, very, very important because especially where you don't have the luxury of space, our brothers and sisters who live in low resource settings would not have the luxury of spacing, and this is about 80% of our population. So people who would have an extra bedroom would be a very small group of people. When coughing and sneezing, then use your elbow to cover your nose and mouth, despite the fact that you already have a mask, and then have a dedicated bin. So this is basically in the ideal setup. In an area where you do not have this luxury, then the main thing is that the sick person should always be in a mask at all times. Okay, so isolation, we had said the duration is basically 14 days from the time your symptoms started. Now, if you find your symptoms are gone by the end of 14 days, then it basically means you're out of the woods. It's unlikely there will be further deterioration. You can go for retesting, but unfortunately the tests can remain positive even a month after you have healed from COVID. So it is not necessary. It's not necessary for you to do a retest unless your place of work insists that you should have a test done before going back to work. Quarantine is not what we are covering today, but if you are exposed and you're worried, then it's 14 days. If you don't develop symptoms within the 14 days, then you're okay. Now, what do we call close contact? Who should consider themselves as a close contact, somebody who would then need to go to self-isolation? If you're in a face-to-face encounter with somebody who later confirms to be sick with COVID, and you are less than 1 meter away from them during your encounter, and you are with them for more than 15 minutes, and both of you are not wearing masks, then it is considered that you could have been exposed. So for instance, as a doctor, I have been seeing patients, I still continue to see patients. We would not allow you into the facility and into the consulting rooms if you're not wearing a mask, and our service providers will wear a mask so that if both of you are masked, even if the patient has COVID-19, then the risk of transmission is minimal, especially if the room is well ventilated. Now, there are those who we call high risk, people who are at risk of getting severe disease. And these are people who are over the age of 60. Our government reduced this to 58. So in Kenya, basically, we're looking at people who are above 58 years. If you are overweight, if you have cancer or TB, if you have multiple medical conditions, diabetes and hypertension being the principal ones, and especially those which are not well controlled. If you have chronic kidney disease, lung, and the other one that is missing here, of course, is HIV, especially if you're not on medication. These are people who would be at high risk, and it is best that if they're in the house with you, that they do not come into that room, or ideally you should not be isolating in an environment where you have such people. If they cannot move, then it may be better that you isolate in a different place. So when it comes to how to monitor yourself, if you have the diseases that are underlying, then make sure they are well controlled. But most importantly, it is very important you get a pulse oximeter. I'll show you pictures of this later on. If you monitor your oxygen levels at least twice a day. If the oxygen levels drop below 90, 92, then you know you need oxygen support and you must go to hospital. Okay. Now, the general advice for us as doctors is that we send you home, we give you some maybe Panadol or something that will help you take care of the fever. You should continue to eat well, remain well hydrated, take food rich in minerals, vitamins, especially food that is rich in green vegetables. Avoid alcohol and smoking, and then use the usual cold remedies. So the normal Kenyan dawa with lemon, ginger, salt gargles, things like those would be useful. Now, steaming is very important. It reduces the inflammation in the airways. It also reduces the thickening of the secretions. So these deep breathing exercises that help to expand your lungs are very good to do while you're steaming. The idea with steaming is the same old thing where you cover your head with a towel over a hot pot of water and breathe in this steam. So generally you would take a breath through your mouth and out through your nose 10 times, and then you do the opposite. You take the breath through the nose and out through the mouth 10 times. When you're breathing out, then you breathe out a little more slowly. So when we say here, twice as long as you inhaled, so I'm breathing in, and then when I'm breathing out, I slow down the breathing out. Saying you're past-lipped would just mean I take a deep breath through the nose, then I breathe out with my mouth pursed like this. And you do that slowly, and you do 10 exercises, breathing through the nose. So if you breathe through the nose, then you're taking the heat into the areas, the cavities in the nose that we call the sinuses. Breathe out through the mouth. When you breathe in through the mouth, then you're taking the hot air directly into the airways and not the sinuses. So that's why it is important to do both. When should you seek medical advice? The main thing is if your oxygen level drops, or if you find you're not improving after 10 days or you're getting worse, then all those things require that you go to hospital for further assessment. How do we take care of the surfaces at home? Our usual jig works very well as a disinfectant, ratio of 1 to 6. So 1 cup of jig to 6 cups of water will be enough for you to use to wipe the surfaces around you and clean the utensils, disinfect the utensils. So you just wash them with soap and water, and then you can disinfect them with this solution. Clothes would be washed in the usual way and dried in the sun, and any waste that is to be disposed then would be disposed in a plastic paper bag, and you can spray in some of the jig disinfectant before closing the bag for disposal. And that basically would then help you to take care of yourself when you're in isolation. Okay, so I will stop that sharing and we go back to our slides. See whether we'll get this. There we are. So we have finished the general things. Now, I don't know whether you'd want us to ask questions at that point or I go on, John Paul.
Uh, I feel we can just go on, then we will have questions at the end. But
Oh,
anyone with a question can still put it in the chat so that
wonderful.
they don't forget. Yeah.
Okay then.
Yeah.
Um, I will have to stop sharing, and my it had frozen. So allow me to start again. Um, run down these slides. We had passed there, so we are here. Then I share. Uh, so this is the next level. It is very important that we take care of the psychospiritual support of the person who is unwell. It's important to have one caregiver, a young person who is in good physical health, who would always wear a mask and not spend too much time in that room. But it is very important that we give psychospiritual support to this person. So I found this chart quite good. We make sure that the person has food, is able to get some reading material, and has clean water and food, and can access medical services. It is very important that we spend time with them in prayer. Remember, we do not want them to feel hopeless. We do not want them to feel like it is the end of the world, because when you're stressed, your immune system doesn't work very well. And therefore, we need them to be positive and to understand that 90% of the people who get this disease are doing quite well. And even those who end up in hospital, majority of them are actually beating the disease and getting to go home. Remind them that they are constantly examining their oxygen levels, and we spend time with them in prayer. If you only have one person in the house, if you have access to a mobile phone, then you can talk to your friends on phone, you can do some virtual meetings, you can basically keep in touch so that you do not feel too lonely. It's very important to remember the proper coughing and sneezing etiquette. We have mentioned this, especially where there is no space for distancing, so that you avoid spreading the disease to others. But unlike this person in the picture, you would still be wearing your mask while among others. If you need to go out, for instance, it's important to go out and bask in the sun because of vitamin D, then just keep distance among those who are around you. It is much safer when you're in an open space than when you're in a closed up area. So physical distancing is the other thing that helps us. The link, you will find it here. This is an organization that talks about mental health, and I thought it was important to mention that. Now, I would like to spend a little time here. This diagram may look very busy, but it is not as complicated as it looks. What we know is that 5 days before you develop your symptoms, the virus multiplies very rapidly in your body. And for these 5 days, you're actually spreading the disease and you do not even know that you are sick. This is the reason why the Kenya Catholic Doctors Association pushed for mandatory wearing of the mask, especially in public places, especially in closed up areas, because we wouldn't know who has the disease because nobody has symptoms at this point. But for 5 days, we are spreading the disease. Then what is marked at day zero, you develop your symptoms. So now you have a dry cough, you have a sore throat, you have headaches, you may have a runny nose, all those things we have described. The virus is still multiplying very rapidly in your body, and then your body starts fighting back and is able to push back the virus. And by about the fourth day, the viral load starts declining and your body continues to destroy it. And by the time you're doing 10 to 14 days, there is hardly any virus in your body. That's why the isolation period is 14 days, because by then the virus is no longer active in your body. Now, I want you to keep in mind this window, because if we are going to have any medicine that can destroy this virus, we only have these 7 days from the onset of the symptoms. Is a very critical period if we are to fight the disease. It means if we have a drug that can destroy the virus and you take it at the beginning of your symptoms, you can drop this curve very rapidly so that you end up with mild to moderate disease as opposed to severe disease. So this gives us a window of opportunity. If we have any antivirus drug that can kill the virus, the first 7 days from the onset of symptoms are the golden hour, the opportunity which we have to treat you. Now, when you go into what we call severe and critical disease, it's important to realize that it is no longer the virus that is causing your disease. It is the many little particles that your body has broken the virus into that your body unfortunately seems to interpret that as many more viruses have been created, and it mounts a very, very, very strong immune response, and it is actually your own body that kills you. So in the second phase of the disease, where we are having chest complications, difficulty in breathing, and those kind of things, unfortunately, it is no longer the virus, it is your own body that is destroying you. Treating this part of the disease is quite an uphill task. It needs to be started early, as soon as your oxygen levels go down, and the medication is really suppressing the immune system so that it stops destroying your tissues in the lungs. So this is why it becomes a very difficult thing to treat. If you were to compare this, say, with pneumonia, in the first phase of the early pneumonia, it is still bacteria that may be causing the disease. And even in the late stage of severe pneumonia, it is still bacteria that is causing the disease. So even if we missed this opportunity to treat you for pneumonia and you came with difficulty in breathing, the same antibiotic we would have used in early phase of the disease is the same one we would use in the severe and critical part, which makes it quite easy to treat so long as you have oxygen support. Unfortunately for COVID-19, the first week is the virus that is causing the problem, which can be treated easily. But the second phase, it is your own body destroying you. It's no longer the virus. It makes this disease very special. The other thing I'd like you to pay attention to is that by the time you develop shortness of breath here, then you're already in severe disease. Now, in bacterial pneumonia, if your oxygen levels drop below 94, you get very severe difficulty in breathing and you run to hospital because you know you're sick. Unfortunately for COVID-19, oxygen levels are dropping to 50% to 60%, and somebody is still laughing and joking with you, not knowing how severely sick they are. So again, if I was to ask you to go home and just take your Panadol and come back when you develop shortness of breath, unfortunately, you'll be very far into the severe illness, and that doesn't augur well for your recovery. So two things we take from here. If there's going to be any treatment that is available, then it must be started soon after you develop symptoms and aggressively so within that 1 week. And you must monitor your oxygen levels so that you can detect the oxygen levels dropping early. If you don't do this at home, then we'll find you come to hospital extremely late when it is difficult for us to help you as a doctor. Now, what determines the severity of your disease is basically three things. How much of the infective organism you got. So if you get a very high dose of infection, both of you are not wearing the mask, the person has a lot of viruses, shouting and screaming, and you are laughing, you're watching your football match or something, then you get a very high dose. And that's why things like bars would probably be the last things that would be opened, because there would be high transmitters. How good is your immune system? So we know that children below the age of 18 are hardly getting very severe disease. In fact, they're hardly in the list of people who are dying because they have a very good, robust immune system. And then this other one is virulence. How severe is, how good is the virus at causing disease? This is where you find different variants, maybe more severe than others. That's what we call virulence. Now, the higher the buildup of viruses in your body within that first 7 days, the peak that we looked at, that peak is what determines how much disease you'll get. So if you have a very high dose of organism, or your immune system is low, then you get a very high peak of the viral load, which means your risk of getting severe disease is very high. If your immune system is good or you got a very low dose, then the chances are that that peak will be smaller and you'll end up with mild disease. The thing is this, and again, it's very important for you to keep this in mind. When I look at you in the face, when you come to my clinic and I make a diagnosis of COVID-19, I cannot tell whether you received a high dose of disease, whether your immune system is good, or which variant you got, and whether it is the severe type or the mild type. I would never be able to tell this. So what this means is that for me as a doctor, I must treat everybody who comes to the clinic with COVID symptoms. You cannot dare to decide this one looks like it is mild, this one looks like it is going to be severe, because the window of opportunity is the first 7 days. Once you miss that first 7 days, whatever will happen to that person is no longer under your control. Let us take this opportunity to quickly understand the masks. The masks don't prevent you from getting infected. Please, ladies and gentlemen, keep this in mind. There is nothing that can prevent the spread of this disease. What we do is we reduce the dose of virus that we receive. So if I am sick and I'm wearing my mask, then a lot of the particles, the droplets that would have the virus will remain on my mask and would not come to you, okay? And if you're wearing a mask and a few of those droplets pass through the mask or the sides of my face and come towards you and you're wearing a mask, then most of them will be left on your mask. If you inhale any, it will be very small. Now, if you inhale a very small dose, then there is a good chance that what you develop is immunity instead of disease. If we are both not wearing a mask, then the chance that you get very severe disease is very high. That's why the mask is the single most effective fight that we have, the item we have for fighting this disease. And it helps flatten the curve, even in countries where they could not do social distancing because of the large population of people. So the aim of the mask is to reduce the dose of infective material that you get so that hopefully you develop immunity as opposed to severe disease. Now, I have shared with you what is the standard knowledge, what we have all been taught out there. But as KCDA, you know, we released an advisory and we indicated that there is effective treatment for COVID-19 and that we should not lose anybody else. Now, the main drug we are advocating for use is called Ivamectin. It's a drug that has been in use since 1970s. Initially developed for treatment of worms, but has been found to have a very high antiviral activity. In the lab, it was able to stop the multiplication of SARS-CoV-2 up to 5,000 times. And in the clinical trials in people who have used it in other countries, it has been shown to be very effective. Ivamectin, right from the beginning, I will tell you, cannot be used by pregnant women or breastfeeding mothers. And the dose we are recommending is that if you're below the weight of 80 kilos, then you just take 12 milligrams once a day for 5 days. If you're heavier than 80 kilograms or 80 kilograms, then you take 18 milligrams once a day for 5 days. And it is very important that everybody who is on treatment for COVID-19 takes vitamin D supplementation. Vitamin D we get free from the sun. Our skin can generate vitamin D. Unfortunately, especially for those in formal employment, you go into your office before the sun is up. By the time you leave to go home, the sun is down. Saturday, you don't have much time to go into the sun. Sunday, you want to rest. And we are finding full-grown adults who are in the tropics who have low vitamin D levels. When I went to check mine, I found actually it was borderline, and I had to go on supplementation. So it's very important, if you can be able to find time, go in the sun with short sleeves, shirts, at least 30 minutes with both hands exposed once a day would be sufficient. If you don't have time every day, then you can do that a little longer over the weekend. But this is the treatment that we are advocating. Now, for those who are pregnant, breastfeeding mothers, or those who have been on preventive care, then the Zelenko protocol is what we are advocating. Is hydrochloroquine, 200 milligrams used twice a day for 7 days. This drug has been in use since 1955, is safe in pregnancy. Zinc 40 milligrams once a day for the 7 days, and an antibiotic called azithromycin once a day for the 7 days. Now, this can be used by pregnant women and breastfeeding mothers. And although it can also be used by those who cannot access ivermectin, because some of these drugs may not be easily available, then we are saying the general population can use the ivermectin, and we spare these drugs for the pregnant and breastfeeding mothers who may be unwell. Now, the person who described this protocol called Zelenko, Dr. Zelenko made it very clear, hydrochloroquine on its own is a waste of time, and zinc on its own is a waste of time, because it is zinc that stops the multiplication of the virus, but it needs hydrochloroquine in order to be able to get into the cells. So he describes the hydrochloroquine as your gun and the zinc as your bullets. If I gave you a gun without bullets, it's a waste of time. If I gave you bullets without a gun, it's a waste of time. The azithromycin, some people have even changed the antibiotic, but because we have not done any studies that oppose what Zelenko has done, it is best that we stick with his protocol because it was shown to be effective. This is what the pulse oximeter looks like, okay? It's a little gadget that you fit into the hand like this, and it monitors your oxygen levels. This picture here shows you SpO2. This is the oxygen levels in percent. So this person's oxygen level is 96. The PR here is the pulse rate. This is the heart rate. So this one has an oxygen level of 95 and a heart rate of 90. It's a very simple gadget, battery operated. It can fit in your pocket. There are very many different varieties you can get from even online stores. But when you take it, always test it. And remember to always use it. Don't use it after you have just come from touching cold water, because if your fingers are cold, then it may give you the wrong readings. It's very important that anybody who is on treatment for COVID-19 or who is being monitored because they have symptoms, if you choose not to take treatment, for the next 14 days, at least monitor your oxygen twice. And if you find it has dropped below 90, you understand you need oxygen support, and you quickly go to hospital. What are the at-risk populations? We had mentioned some of these people. These are people who have to be very careful. It is important that if you have anybody who falls on this list or you're one of them, if you can afford to do a vitamin D level, and if you find it is low, start on supplementation. If you cannot access a test for vitamin D blood levels, then just start on vitamin D supplementation. It doesn't hurt you. Or make sure you get some time to bask in the sun for 30 minutes in short sleeves every day. There is a protocol for prevention of treatment using ivermectin where you can take 12 milligrams weekly. But unfortunately, this may prevent you from developing immunity, which then means that the day you be caught by this disease, you may be in a lot more trouble. So if you have a good vitamin D level and you are wearing your mask, you avoid getting infected. If you get a very small dose of virus, then you may actually develop immunity. And if you do get symptoms, even if you are taking preventive medicine, it is very important that you're treated aggressively. But remember, vitamin D is very important for our immune response, and it is very important that our at-risk populations are on vitamin D supplementation all throughout this season of COVID. Thank you very much.
Thank you very much, Daktari. We are welcoming questions. Those who have questions, please, you can either raise your hand or you just put it down on the chat. But I think the first question I would like to ask is, I think from your talk, it's becoming clear that if you already had it, you are not supposed to have it again. Is it possible to have it multiple times?
It's an interesting question. It has been raised. There are a few people who have tested positive before and then developed symptoms. Some may have done the test when they didn't have symptoms. It could be a false positive, or indeed that they may have had a mild disease and didn't develop symptoms. So at this point in time, there are a few people who are saying who it is possible they have gotten the disease twice. It would also mean that your immune system is not quite up to, is not functioning very well. But the idea is, and that's why it is important for us to keep this in mind, if it was possible to get COVID twice, then the curve would never flatten. Even the common cold, what happens is that the child comes with it from school, then the father gets it, then the mother gets it, then the other children, and the one who got it first never gets it again. Okay, if it was to happen again, if it meant that you didn't develop any immunity, then it should start the round again, and everybody would keep getting sick the whole year round, isn't it? So the fact that even in homes where we have nursed patients with COVID, is one person who is getting it and most of the others are not getting it, then it is very important to understand that the curve would never flatten if majority of the population were not developing immunity. Then remember last year, sometime I think in August or thereabout, KEMRI had done a study and they had found that about 30% of people living in Nairobi had already developed immunity. And they had postulated that by the end of the year, December last year, about 50% of the people in Nairobi will have immunity. So when you check the blood level, the antibodies last for a very short time, but viral infections, it is cellular immunity that lasts the longest. The one experience we know for sure is that SARS that occurred in 2003, there's some people who developed SARS have been found to have immunity against SARS-CoV-2, and this is 18, 19 years later. So the last one, of course, is that if you cannot develop immunity against this virus, then it is not possible to make a vaccine. Okay, so it's another scientific fact. For you to be able to make a vaccine, there must be a part of that virus that is stable enough for you to extract and create a vaccine. Now, the person who gets the vaccine gets a portion of the virus. The person who gets infection gets the whole virus. And therefore, the immune system would be able to make more antibodies against the virus from many different angles as opposed to the person of vaccination. And therefore, we know naturally anybody who gets natural infection always builds up better immunity than a person who has gotten a vaccine. So those are the main things to consider.
Thank you. There was a question from Ada. Thanks so much. Please explain why population in overcrowded slums who don't wear masks are mostly spared from COVID, and it's mainly found in middle and upper class neighborhoods.
That is a very good observation, and it is true. And the answers are in two ways. One is exposure to sunlight. Okay, so most of the people who are living in slums who spend most of the day outside the house, you only go into the house to sleep. And then most of them are in informal employment, most of what we call juakali. So is Mama Mboga, she's in the sun the whole day, is a juakali artisan who has removed his shirt to make the stuff he's making. And therefore they're exposed to the sun. There is a guy who is in the construction site. That is one of the most important things. The other one is that they take foods that are very rich in vegetables. So it will be ugali and skuma wiki, it will be ugali and managu, it will be ugali and something else. Most of their food will have vegetables, and vegetables have a lot of minerals and other things which are very protective. When you now come to the middle and upper class people, then you find you are hardly in the sun. And when you're in the sun, is maybe a jog very early in the morning at 6 before the sun comes up. Most people are wearing long sleeved shirts and trousers, and that basically makes us exposed. And we think that vegetables is a very bad food to take. We have to even push our children to take vegetables, and that basically makes us more prone. Then you add on to that the diabetes and high blood pressure because of all these lifestyle things. You find it obviously that those would be the groups that would be hit hardest.
Thank you. Thank you. Now, there was another question I had posted. One is, how do we test for vitamin D levels and what is recommended level? And if there is any daily dosage that is recommended.
If we could assume you're not sick, if you could spare some time, even if it is your tea time at the office, fold up your long sleeves and go out in the sun for at least 30 minutes. You basically may not need any supplementation. But if you already have symptoms, we cannot dare to take a risk and know whether you're in the one who has low levels or not. It's usually a blood test. It's a blood test that is done, and there are different levels. There is very low levels, then there is borderline, then there is normal levels, and it will come with all those interpretations. So it's easy to tell. But you might find it will cost maybe 2,000 or 2,500, which may be just what you need to buy your supplements. So the question is whether you have the resources to do so. If you can be in the sun, be in the sun. But if you are sick, if you have developed symptoms, please don't wait to know whether you have low levels or not. Kindly just start taking medicines. Now, vitamin D comes in several different formulations. There is one that is 5,000 international units that is taken daily. There is another one that is 60,000 international units that you can take weekly. And there is another one that is 300,000 international units that you can take once in 2 months. So it just depends on which, that's why I didn't write the dose, depending on what is available in the place near you. But if you can be in the sun 30 minutes a day in short-sleeved shirts, then you would do yourself a good service.
Thank you. Now, the other question is, good evening. The ivermectin used to treat adult, is the ivermectin used for adults only or even for children? But if it is for children, do we use the same 12 mg daily for 5 days?
The children we are not treating. Like I said, majority of them respond very well. We are hardly seeing any one of them developing severe symptoms. The few who need to be admitted, they're hardly going to ICU. So it is best that we do not treat children. So anybody below the age of 18, unless you have those at least 60 kilos or above, it is best that you just take, the steaming is very important. The honey, ginger, and lemon is very important. And the vitamin D supplementation or sun exposure. So for the little ones, I didn't put up the statistics, the mortality, but you'd notice from below 18, we have very few. So I wouldn't advocate for treating the children.
Thank you. Thank you very much. Uh, any other question from the participants? I'm not seeing any other, and I've not. There is another one that I've forgotten. I know it will come in. Any other question from the participants uh, with respect to the discussion? Okay. I see a lot of people are just coming in.
Hello, can I
Yes,
ask a question?
yes, go ahead, Doctor.
Are we going to talk about the vaccine? Because I'm meeting many people who are saying they're waiting anxiously for the second dose. What advice do you give about the vaccine to take or not to take, and why?
Okay, thank you.
Yeah, Dr. Ida. Yes, I was hoping that would not come up because in my topic it wasn't to be discussed. Um, we have an advisory as KCDA and we discuss the issue about the vaccine. And the simplest way to answer that question is that if you have effective medicine against any disease, then you have no business developing a vaccine for that disease. And that would explain why the pushback against treatment is so severe. It means if you accept that there is treatment against COVID-19, then you must stop the vaccination process altogether. So there will be very many forces interested against that. We did what is called a cost-benefit analysis, and we're able to demonstrate that whereas the government would need about 34 billion to vaccinate a large enough group of people for there to be any effect felt, the truth is that with 6 billion, we could put everybody on this treatment we are talking about, everybody who will develop symptoms, because that's just 10% of the population. And then you minus the group that is below the age of 18. With 6 billion, even at the current market price, we could actually treat the whole population. In terms of cost effectiveness, giving the treatment would also be more cost effective than vaccinating the largest majority of the population. The other thing to consider is that if 90% of the population that is getting sick with COVID-19 is having very mild or no symptoms at all, and they're developing their immunity, then we are saying only about 10% of the people who catch COVID-19 would require treatment. Then it would follow that if I give treatment to everybody who is sick, and even assume that whatever medicine I use is experimental, then it is only 10% of the population that would be at risk. But if I use an experimental vaccine and I give it to 90% of the people who are well and it has complications, then I will have put the whole population of normal, healthy people who would not have suffered severe COVID at risk. So then again, the question is that the best way to go, or should we use medication or not? Then finally, the question that still bothers me very much up to today is why vaccination is being tied to a passport. Why is it that people who are vaccinated are being given a certificate? And in countries like the US, those who are vaccinated are now being told they can actually go, to have to walk around without masks. Now, remember, they have already told us that if you get the vaccine, it will not stop you from getting the disease. And if you get the vaccine, it will not stop you from transmitting the disease. Why would you be allowed to walk around without a mask if you can still spread the disease and you can still catch the disease? So again, the immunizing people and giving them passports doesn't make sense because they still remain at risk and they can still spread the disease. So those are all very interesting questions. But what I would like, as a doctor, what I'd like to say is this. Before I can recommend a vaccine for my patient, I would like to see evidence of this vaccine's usefulness and this vaccine's effectiveness. Now, most of the evidence that was used to allow these vaccines for experimental use is still held by the FDA and the others who approved it. So even in the US, it is not approved for general use like the normal vaccines. It has been allowed to use as used for experimental as an experimental vaccine. So I retain the position that because we have effective treatment, then vaccination is not useful, is not necessary. Those who want to go for vaccination, then at least convince yourself by finding evidence that the vaccine is going to be useful to you and it is worth taking the risk. Ask your doctor to give you the evidence that they have that support their position, so that at least, at the very least, you have an informed decision. And then you take responsibility for your choice. But as a doctor, I would not advise my clients to take an experimental vaccine for a disease that has effective treatment.
Thank you, Dr. Now, I had another question. That is the one I said I will remember. You were talking about a situation where your immune system starts becoming your own danger. Well, probably that if you have a better immune system, somewhat it starts fighting and it becomes a problem. Maybe you can clarify a little bit of that more, and possible solution or remedy or prevention for that.
No, that understanding is not correct. What I said is that when the virus is multiplying in your body is able to push back and destroy the virus. But as the virus is destroyed, it breaks up into little parts, and your body then reacts to all those little parts like they are different viruses. So instead of having a calm immune system that is just fighting the virus and then slowing down and stopping, you now have a hyper immune reaction. It is your body overreacting that now destroys your lungs and other organs. So it is your body overreacting from the infection. It has nothing to do with a good immune system. Remember, if your immune system was good, your body would have destroyed the virus without allowing it to multiply very high, and therefore you just get a mild disease or no symptoms at all, and you'd go on with your normal business. The minute you get symptoms, it means there is something about your immune system or the dose that you got or the variant of the disease you got that was severe enough to make you get sick.
Thank you. Thank you. I got it now. Now
Yes.
there is a question from Anne Kyoko. Anne is saying, I got exposed. I was having a long meeting with somebody who just received the results that he or she is positive. So what do you advise?
Yes. The thing is, if Anne has been exposed to the sun, she's eating well, and she has a good immune system, then we do not have much to worry about. If she is not sure about those, I would advise her to start taking her vitamin D supplementation very quickly. Ideally, she should go into what we call self-quarantine, stay away for about 10 days to see whether there will be any symptoms that develop. But if she experiences any symptom at all, headache, sore throat, fever, runny nose, any of those things we mentioned, is very important she takes a full treatment of the Ivamectin for 5 days. Depending on her weight, then it will either be 12 milligrams or 18 milligrams. I would not suggest immediate start on treatment, because 90% of the people are getting very mild disease or no symptoms at all. So that we don't want people just taking drugs out of panic. Remember, we also said if you're on preventive treatment, you may slow down your body's capacity to develop immunity, which is also not good. So just go into the 10 days of self-quarantine and monitor. If you develop any symptoms, start your ivermectin treatment immediately and get a pulse oximeter, monitor your oxygen levels. But in the meantime, take your vitamin D supplementation and then steam at least twice a day.
Thank you very much. Now, uh, there is a question to do with PCR tests, and I think it would be important to talk about the test for COVID, because there are people who go, they just want to confirm that they are right. There is the push also from the authorities, maybe the government, people who are tested en masse, and some of them were discovered to be having COVID or something. How reliable are these tests, and is it recommended that we just go and volunteer ourselves for tests?
Is a very good question. The PCR test is in itself a test that is for studies, is not for diagnosis, is for research. The PCR test does not detect the virus. The PCR test detects the genetic material of the virus, which then means if you have a positive test, I cannot tell you whether you have an active disease right now ongoing in your body, or you had suffered from the disease and your immune system has already defeated the disease. So that's one of the disadvantages we have with the PCR test. It doesn't, like if I took your blood and I looked under the microscope for malaria, what I would see is malaria. And if it is positive, I know for sure you have malaria. The PCR is testing genetic material of the virus. It could have been dead and defeated long time ago, or it could be actively infecting your body. Now, that said, of the people who test positive for COVID-19, then you may have what we call a false positive. So you may test positive, but you do not have COVID. It's not a very big number. And especially if you don't have symptoms, it's very hard for me as a doctor to interpret a COVID test positive. So if you come to me and you have a positive test and you did it because you are going to travel out of the country, but you have no symptoms of COVID, then I would not put you on any treatment. Okay? I would not treat you. I would not put you on any treatment. Now, if you have symptoms of COVID, you find that sometimes up to 30% of the people will be told they're negative, yet what they have is COVID-19. So again, it's very important that people understand when you come to me and you have symptoms, in this era of COVID, even if your test is negative, I will still put you on the full treatment because up to 30% of the time the test could be negative. Now, when that is said, I would suggest that if you have capacity to do so and you have symptoms, please do the test because it's very important for us to have the correct numbers in the country. But if your test is negative and if your test is positive and you have no symptoms, then there is no need to take medicine. You can monitor and see whether it was an old disease that has recovered, or if you develop symptoms and you start on your treatment.
Thank you. That's very interesting. Yeah. So, any other question from the participants?
I'm seeing a question there about whether ivermectin should be for 5 days. Initially, there are two protocols. You can do a short protocol where you take 12 milligrams on the first day, and then maybe on the 5th or 7th day, you take another dose. But we have found that it is better to take the long one, the 5-day one, so that we don't miss any cases that may end up dipping into severe disease. So let's treat everybody aggressively right at the beginning when we have that opportunity of 7 days, so that we don't miss someone.
Thank you very much. Any burning question, any clarification that somebody may want? This is
Yes,
your
Paul. Yes, Paul. Bridget has something. I raised my hand.
Yes, Bridget, say.
Hi, Dr. Ri. Thanks a lot for the session. Very, very, very insightful. Doc, Ida has asked something I wanted to ask, but if I do not want, because that's what you have taught me, I'm not going to have the vaccine by any chance. Do I have any, do you call it legal backing to tell my employer that I am not comfortable with getting the vaccine? Because some of us employers are sending around forms for us to fill, and like as if we have to get the COVID vaccine, like a must, something like that. Do I have the freedom to choose or not choose? Over.
Yes, well, Bridget, that's a very good question. I hope your decision not to take the vaccine is not based on just what I have advised, is actually informed by the fact that there is evidence that treatment works. And anybody who wishes you to take a vaccine should point you towards the reason why they feel it is important. Now, the government has made it very clear that the immunization against COVID-19 is voluntary. And if anybody forces you to take this vaccine, then they will be breaking the law, they will be abusing your rights, which would be an extremely bad thing. So what I have told most of the people who have been under pressure or being coerced to take a vaccine at their place of work is basically to write a formal email to the employer or to the person who is suggesting you take the vaccine, and you ask the following questions. You say, kindly share with me scientific evidence published in peer-reviewed journals that has demonstrated that this vaccine is safe. Give me the same evidence published in peer-reviewed journals that show that the vaccine is effective, and explain to me whether taking the vaccine is voluntary or mandatory. And then you send that to them, and you copy that to me, to my email, and you copy that to the KCDA email. And then we wait for them to respond. Because right now, what is being carried out is the largest vaccine experiment ever tried in the whole of the world. And that's why data is being collected every day to see what is happening to people who receive this vaccine. And because it is only allowed for experimental use, even in countries like UK and the US, you cannot sue the manufacturers if something goes wrong when you receive this vaccine. You cannot sue anyone because it is an experiment and you registered for the experiment. You have to sign a consent form to say that you have accepted to take the vaccine on your own volition and that you report any side effects that you will experience. So let it be very clear that we are actually going, anybody who is receiving this vaccine is enrolling in an experiment. And it should be very clear in your mind. So the fact that the vaccine is voluntary, and the fact that you cannot sue the manufacturers if anything goes wrong with you, should be something that the employer should be very careful about. If there is anybody in HR listening to me right now, you would actually be breaking the law by coercing or pushing your employees to receive these vaccines. So let people make their decisions. Those of our brothers and sisters who agree to get the vaccine, we are not going to disown them. Those who do not want to take the vaccine, let their choice be respected.
Thank you very much. Edna wants to ask a question.
Is Edna typing or going to speak? You're muted.
Okay, let Edna use mine.
Yeah, sorry for that challenge. My question, can you hear me now?
Yes.
Yeah, my question is around some of us who are not for the vaccine and may find ourselves later getting transfused, and the blood is from somebody who got the vaccine. Is there a challenge? Maybe 5 years down the line, if I get blood from somebody who got the vaccine, kindly explain.
is a good question. I would not expect so. What we need to understand is what the vaccine in Kenya is. Now, what they've done is that they've taken a virus from a chimpanzee that is called an adenovirus. And then they have put genetic material of SARS-CoV-2 into this virus so that the virus grows the spike proteins. So this is a genetically modified virus that has been created in the laboratory. Then they have removed its capacity to multiply itself, and then that's what they're injecting into you. So you will develop antibodies against the adenovirus and the spike proteins that are found in the SARS-CoV-2. And that is why it is hoped that when you are exposed to SARS-CoV-2, your body will be able to recognize its spike proteins and destroy it. So you will develop some form of immunity, but the virus itself will not be living in you, so that if you offer your blood a few years from now, it will still be present. So that is unlikely to affect somebody in future. So those who are vaccinated would not threaten those who are not vaccinated, and vice versa. The other thing that is interesting is that for respiratory viruses, then the first immune response you get is called cellular immunity. The antibody immunity tends to come later and is usually very short-lived. And the antibodies you tend to make are IgA antibodies, which are found in the airways. Now, when you take the virus and inject it into the muscle, then you skip the cellular immunity, and what you form is antibodies. So the virus is going to come through your airways. It will not find any defense mechanism in those areas, and would only be compromised if it goes into the blood system. And that might explain why the vaccine is being said it will not prevent infection, it will not stop you from transmitting the disease. It is hoped that it will prevent severe disease and death. That's basically the aim of the vaccine. And we can do this also very well by using early treatment.
Thank you. Thank you. I can't see any other question. I hope people are happy. And unless there is any, somebody can raise up hand or unmute and say. Going once. Going twice. Okay, no question. Now I will ask somebody maybe to say a vote of thanks. And in this case, I want to ask the figures. The figures, I can see they are logged in. We can say vote of thanks, and then we can have somebody pray for us. I can see we have Father Obunga. I want to believe that is a Catholic priest. He can pray for us and bless us. Thank you very much. So the figures, maybe Job or Rosa can say a vote of thanks. Okay, they have audio issues. I will ask Lucy. I want to believe this is our very Lucy. Lucy, would you say something, say a vote of thanks to everybody, to Daktari, and then Father can pray. Lucy? Where is Lucy? Okay. Seems like they're having audio issues or something. But in all, we are very grateful. I believe this is a very, very important information, a very important message. Though this is not full house like we expected, like Dr. Ari was saying, seems like everyone became an expert in this, which is quite interesting. And well, that is what Kenyans can be. Maybe we will be better able to protect ourselves. But I think this is a good and timely information that needs to reach everybody so that things can go back to normal. Economy can start moving on and people will live their normal lives again. It's likely that most of us have developed that full immunity, that herd immunity, without much pressure. And so if all of us can get this information, then it means we are safe. We don't have to panic. Like one of the procedures stated in that guideline for Nairobi Hospital, we need to be calm. We need to not to panic and know that whenever we have that problem, there is medication. We can be treated and it's safe. So thank you very much, Daktari, and we hope to continue doing the same again and again. Thank you for everyone who logged in, including Dr. Eda. Thank you, Winnie, Ruben, and all these people I can see here. And we don't take it for granted. Take the message home, take the message to all your loved ones. Let them be able to feel some relief that it's possible to get full recovery. Very few people ultimately really get ill to the extent that they need to be hospitalized, according to what Dr. Ari has said. So I'm very grateful, and we are very grateful as the Family Life Group for St. Paul's, and we hope that this is going to help some families be able to cope with whatever the situation they may be in. And Dr. Ari, if you have some final word you can say, if not so, we can call Father to bless us.
It's just that we are going to launch a campaign soon that is called Okoa Maisha. The information about the availability of treatment is not available to majority of the people in this country. And we feel if it was possible that a large section of the population were to know this and we started their treatment as early as possible, we may actually be able to defeat this disease earlier, sooner rather than later. Now, we are not going to be controversial. We are not going to stop those who want to get their vaccines. And in the same way, we also expect to be given space to share with the Kenyans the information we have, the message of hope, so that together we may be able to defeat this disease. All we want is to go back to normal as soon as possible, stop the deaths, stop the economic hemorrhage. If that is the conviction of those who want to take vaccines, it is also our conviction, and working independently towards the same goal, we should be able to defeat this disease.
Thank you very much. And I believe that is something that can be achieved within 14 days. If lockdown worked, we won't need any other lockdown. Curfews haven't worked. So if we use this, I believe 14 days or 1 month, the whole of June, we should be able to get back to normal by July. Thank you very much, Daktari. Father, karibu and bless us, then we can go home in peace. Kindly unmute again.
I am unmuted. Are you getting me?
Yes, go on.
Yes, I want to thank you for the wonderful discussion. Let us now pray. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. God our Father, we thank you for the gift of discussions we've had. We thank you for the gift of wonderful doctor who has given us the knowledge and understanding of the current pandemic. We pray, Lord, give us courage and strength to persevere during this time of pandemic. Bless all our doctors so that so that the drug can be found to overcome the challenge. Lord, amen. The Lord be with you.
And with your
May
spirit.
the Almighty God bless you in the name of the Father, and of the Son, and the Holy Spirit. Amen. Thank you.
Thank you very
Amen.
much, Father. Thank you, everyone. Thank you all. Have a blessed evening, and let's keep preaching. Thank you.
Thank you.